Hello, mortals. I am Dr. Sombrio, and today we are going to enter the realm of one of nature's most feared villains. Imagine a virus so lethal that it turns your own body into a self-destruction machine, causing your organs to literally dissolve while you bleed from every orifice. In 2014, in West Africa, a 32-year-old nurse started with a simple fever. Within 5 days, she was bleeding from her eyes, nose, and mouth. And within 7 days, her organs had liquefied internally. The killer? The Ebola virus. But what exactly does this microscopic demon do inside your body? The name Ebola comes from Ebola River in Zaire, now the Democratic Republic of Congo, where it was discovered in 1976. But the real story began long before that, deep in the African forest, where fruit bats carried this silent killer for millennia. The first documented outbreak infected 318 people and killed 280, a fatality rate of 88% that made scientists realize they were dealing with something never seen before. Ebola is not just a virus. It is an architect of cell death. There are 6 known species: Zaire Ebola virus, Sudan Ebola virus, Thai Forest Ebola virus, Bundibugyo Ebola virus, Reston Ebola virus, and Baumali Ebola virus. Zaire is the most lethal with a mortality rate of up to 90%, while Sudan kills about 50% of its victims. This pathogen has only 19,000 nucleotides, smaller than many other viruses, but simplicity is its diabolical strength. Under an electron microscope, it looks like a deadly snake, filamentous, curved, approximately 80 nanometers in diameter, and up to 1,400 nanometers long. Ebola's strategy of destruction is a masterpiece of viral engineering. First, it hijacks your dendritic cells and macrophages, the elite soldiers of your immune system. Instead of protecting you, these cells become viral factories that produce millions of copies of the invader. Second, it specifically attacks the endothelial cells that line your blood vessels, creating microscopic leaks that cause massive internal bleeding. Third, it disables your ability to clot by releasing toxic proteins, so the blood doesn't stop flowing. It's as if someone has permanently broken your body's brake system. But here's the most diabolical part. Ebola doesn't kill your cells immediately. It programs them to commit suicide through a process called apoptosis, causing your own body to self-destruct in a coordinated manner. Infected cells release inflammatory cytokines in absurd amounts, creating an immune storm that further damages your tissues. It's as if the virus were a hacker that invaded your body's operating system and reprogrammed it to self-destruct. The first 2 to 21 days are the silent incubation period, but when symptoms begin, it's a progressive hell divided into well-defined phases. Phase 1. The first 3 to 5 days, sudden fever that can reach 104 degrees Fahrenheit, intense headache as if someone were hammering your skull, severe muscle pain, extreme weakness, and profound malaise. At this point, it looks like the common flu, but it is a prelude to the apocalypse. The virus is already multiplying exponentially in your body. Phase 2, days 5 to 8, violent and uncontrollable vomiting, bloody diarrhea that can reach 10 liters per day, excruciating abdominal pain, red rashes spreading across the body, severe sore throat, and difficulty swallowing. At this stage, dehydration becomes critical and organs begin to fail. Stage 3, the final horror from days 8 to 12. Bleeding from the eyes, nose, mouth, ears, and even the pores of the skin, black vomit like coffee grounds due to digested blood. Internal organs literally begin to liquefy, hemorrhagic shock, convulsions, delirium, coma, and death from multiple organ failure. The liver turns into a necrotic mass. The kidneys stop filtering the blood. The heart cannot pump properly, and the brain begins to swell due to internal bleeding. How does this demon reach you? Initial transmission occurs through direct contact with infected animals. Frugivorous bats of the species Hypsignathus monstrosus, Epimops francati, and Myonicterus torquata are the natural hosts. They carry the virus without getting sick, like living reservoirs of death. Primates such as chimpanzees, gorillas, and monkeys can also carry the virus, but they die as quickly as humans. Among humans, transmission occurs exclusively through direct contact with bodily fluids from symptomatic individuals: blood, saliva, vomit, urine, feces, semen, breast milk, sweat, and tears. A single microscopic drop of infected blood contains between 1 million and 10 billion viral particles, enough to infect thousands of people. The virus can survive at room temperature for up to 6 days on dry surfaces and several weeks in bodily fluids, turning medical equipment, clothing, and utensils into deadly traps. Interestingly, asymptomatic people do not transmit the virus. They only become contagious when they start to develop a fever. But here's a macabre detail. Men who survive Ebola can carry the virus in their semen for up to 18 months after recovery, turning them into biological time bombs for their partners. The numbers are absolutely terrifying and reveal the true face of this demon. The mortality rate varies between 25% and 90% depending on the strain and quality of treatment. The incubation period is 2 to 21 days, with an average of 8 to 10 days. The virus can survive at room temperature for up to 6 days on dry surfaces. Since 1976, there have been more than 30 documented outbreaks in Africa. The largest outbreak in history occurred between 2014 and 2016 in West Africa, infecting 28,616 people and killing 11,310, a tragedy that showed the whole world the destructive power of this pathogen. During this apocalyptic outbreak, entire villages were wiped out. In some communities in Sierra Leone and Liberia, the mortality rate reached 70%. Healthcare workers were the most affected, 881 infected and 513 deaths, because they worked on the front lines without adequate equipment. The outbreak was only brought under control when the international community mobilized massive resources and implemented military containment measures. The treatment of Ebola is a race against time and a battle for life. There is no specific cure, only intensive supportive care. Patients are isolated in maximum containment units, wearing personal protective equipment that looks like spacesuits. Treatment includes massive intravenous hydration to combat dehydration, blood transfusions to replace blood loss, medications to control fever and pain, antibiotics to prevent secondary infections, and respiratory support when necessary. Recently, some promising experimental treatments have been developed. REGN, EB3, and MAB114 are monoclonal antibodies that have been shown to be effective in reducing mortality when administered early. There is also ZMapp, a cocktail of antibodies that has saved some infected American healthcare workers. But all these treatments only work if started within the first 72 hours. After that, the virus has already caused irreversible damage. Prevention is literally your only armor against this demon of death. Completely avoid contact with wild animals in endemic areas, especially bats and dead or sick primates. If you work in hospitals, strictly use personal protective equipment, double gloves, N95 mask, goggles, waterproof apron, and boots. Wash your hands obsessively with 70% alcohol gel for at least 20 seconds. Never touch the bodily fluids of suspicious people without adequate protection, and keep a minimum distance of 2 meters from infected patients. If you travel to risk areas such as the Democratic Republic of Congo, Guinea, Sierra Leone, or Liberia, monitor your temperature daily for 21 days after your return. If you have a fever above 100.4 degrees Fahrenheit, severe headache, muscle aches, or any suspicious symptoms, seek medical attention immediately and report your travel history. Every hour delay can be the difference between life and death. Remember, mortals, Ebola is more than a virus. It is a grim reminder that we are but fragile flesh on a planet teeming with microscopic predators. A single viral particle, invisible to the human eye, can trigger a cascade of destruction that literally dissolves you from the inside out, turning your body into a bloody mess while your consciousness still witnesses the horror. This is nature's absolute power over our arrogant humanity. If this knowledge of darkness has disturbed you sufficiently and made you question fragility of existence, leave a like to feed the dark algorithm that connects us. And if you want more macabre secrets of medicine that humanity prefers to forget, subscribe to the Scientific Horror Channel. Until your next appointment with death, if the virus allows you to survive that long,